So we are starting with the formulations now. We'll study a few of those today, and then we'll continue tomorrow with maybe herbs, diseases, and formulations. So the first formulation that we are going to talk about is Arogyavardhini. Okay. Now, I would say that Arogyavardhini is the first one that we are studying, but it is also one of the very important formulations as such. Okay. Um, if you look at the name, Arogya Vardhini. Arogya means health. Vardhini means improving, increasing. That is the literal translation of the word Arogya Vardhini. Arogya means health. Vardhini is increasing, improving. So Arogya Vardhini is a formulation which is basically very effective in improving the health, increasing the health of a person, improving the health of a person through its various effects that are seen on the body. Now, when we look at the ingredients of these preparation, the first one is mercury. Second is sulfur. Then is loha bhasma, which is iron bhasma. Then is abrak bhasma, which is mica. Yeah. Then is tamra bhasma, which is copper. Then is Triphala. You know what Triphala is. Yeah. Then is Shilajit. What is Shilajit?
Good health and vitality. Like, yeah, vitality.
But what is Shilajit?
I think isn't it a salt or something from the Himalaya?
So Shilajit, the word Shila means rocks. Okay, rocks. So this is basically like a what you can say, like a resin or a exudation that basically comes out of the earth in the big rocks in the mountains and particularly in the Himalayas. Okay, so this is like it's in a slang it is said like it's the sweat of the mountains. Okay, but what it means is, it's something that is extracted out of the earth through the rocks, through its crevices, etc. So, and this Shilajit is very, very effective as an antioxidant, as a rejuvenator, improves the strength, improves vitality, is aphrodisiac. So it has got multiple benefits. Also, Shilajit is very effective in fat burning also. So it is very effective for fat burning. So is also used in obesity or reducing weight, reducing fats. Then Google, we have studied Google that it is Commiphora mucul, which is the resin. It's a gum from a tree, which is used mainly for Medha Dhatu, which is used for the joints, etc. Chitraka, I think we have studied this herb Chitraka. If you remember, Chitraka, the synonym of Chitraka is also Agni. The synonym of Chitrak is Agni. And it is supposed to stimulate the Agni. It is extremely strong in stimulating the Agni. It is like fire. That is what is Chitrak. And also, if you remember correctly, we had studied Chitrak and while studying that, I had also mentioned that there is a lot of research going on Chitrak in terms of its efficacy in reducing the antibiotic resistance in the cells. So the extract of Chitrak, Plumbago zeylanicum, that is the Latin name, the extract of Chitrak is being used, or which is it's been injected into the cells in the laboratories, and they are studying, they are finding very good results in the antibiotic resistance being reversed. I had mentioned this when we were studying this up, that whenever a person is taking antibiotics, over a period of time develops resistance to certain antibiotics. And that is why newer antibiotics, new advanced antibiotics, or more advanced antibiotics, the next generation antibiotics have to be created. Because the earlier antibiotics, the body or the microorganisms, they become resistant to them. So this Chitrak extract of that, supposedly when it is injected in the it's at the research level at the moment, it's injected in the cells, it tends to reverse this resistance. So what it means is, internally, if Chitrak can be is taken, it will reduce or it will remove the antibiotic resistance if it is taken. That is what is the uh, meaning of that. Katuka, this is again a herb which is um, excellent liver tonic. It is excellent hepatogog. What is hepatogog? Hepatogog means a substance which stimulates the bile secretion and also brings the bile into the digestive system effectively. So it is not just about secreting the bile, it also has to be brought into the digestive system for its functioning, which is removing the bile from the liver and the bile duct and the gallbladder and bringing it into the digestive system, which is the small intestine. And that is the function of Katuka. It is a very strong liver stimulant, hepatogog, improves the liver function. And this is triturated with neem swarasa. Neem is basically, again, Azardiracta indica, which is a bitter herb with, uh, Katuvipak and Shitavirya, that is cooling in its nature. Neem is again excellent as a blood purifier, as a blood cleanser, as a liver stimulant, improves the liver functioning, improves the rasadhatu quality. So neem in general being bitter, it is a very good liver stimulant and a bitter tonic kind of a thing. Now, when we look at the other substances which are there, mercury, sulfur, iron, bhasma, mica, copper, one thing which is important here to understand is that the mercury and sulfur that are used in formulations, okay, they are used after processing them in a certain manner. Okay, the mercury and sulfur are not just taken in form of mercury and sulfur and added to the formulation. So whenever mercury and sulfur are used in formulations, what is done is the mercury is purified in a particular manner. The mercury is purified in a particular manner, which is it is triturated with garlic juice several times till it gets purified. There are certain indications given in the textbooks as to how do you understand whether the mercury is purified or not. So till those indications are reached, it is triturated with garlic juice and it is processed with garlic juice for the purification process. Now, this purification process of mercury basically makes it non-toxic. Okay. But even though it becomes non-toxic, it cannot be used in that form as it is into the formulations. Same is with sulfur. Sulfur as it is toxic in nature. It has to be purified first. So it is purified with milk, and after purification it becomes non-toxic, but it is still not used in the same form as sulfur. What is done is the mercury and sulfur are mixed together, and they are grind together for long duration. Like they will be pulverized together, mercury and sulfur, they will be pulverized together for maybe, months. What happens with that is the mercury and sulfur. Mercury, is silver colored liquid kind of. Sulfur is a yellow colored powder. Now, when you mix these two together and pulverize them together, it combines to form a very different entity or a different substance, which is called as kajali, which is black in color. Like a black powder, very fine black powder is formed out of it, which is used in most preparations where mercury and sulfur is used. Mercury sulfur will not be used in their original form. They will be used in this manner, which is called as kajali, which is a purified mercury, purified sulfur mixed together, pulverized together to give this black colored fine powder, which will then be used for in the medicinal preparations. Yes, Dory.
You, how do you see when the mercury or the sulfur are purified enough? What's the signs and symptoms to it?
So for sulfur, they have very clearly said the number of times you need to process the sulfur with water. Okay. Whereas for mercury, they have said that when you triturate the mercury with garlic juice, the garlic juice becomes black in color. Okay. You have to keep on the moment you mix the garlic juice with mercury and you pulverize it together, you mix it together, grind it together, the garlic juice will become black. You have to continue doing this process till you reach such a stage that even after mixing garlic juice with mercury and pulverizing it together, the garlic juice doesn't turn black. The garlic juice retains its color. You have to process it till that time. Now, it is said that usually this will happen when you do this process about 8 to 10 times, but it may take longer also. It may take 12 repetitions of doing this also. But the signs have to be followed. It is not the number that that has to be followed unless they have said that you do it for 12 times and it will get processed. If they have not said the number, then you have to do it till you achieve that particular symptom or that particular sign.
So do you, so if I understood that the garlic juice will become black when it's mixed with the mercury, the more you keep going, then it will come back to its natural color?
So when you mix garlic juice with mercury and you pulverize it together, the
Yeah.
garlic juice will become black.
Yeah.
Okay, so when that happens, when that has happened, it has turned black. Then you remove the garlic juice again, add fresh garlic juice, again do the process, again mix it, again pulverize it. Again, when it becomes black, again take it out, throw it out, add new garlic juice. In this manner, you have to keep on repeating it several times till the garlic juice that you have added, after pulverizing the mercury with that also, it doesn't turn black.
Okay.
Okay, clear? So mercury sulfur in this manner is used for medicinal preparations. And when you prepare the mercury sulfur combination correctly, okay, and even if you do the testing of the ingredient like this, testing of a product like this, you will not find or you will not be able to get any mercury out of this product back. because mercury has completely lost its state of mercury, and same is the case with sulfur. You will not be able to get it back from this product, meaning if you process it, if you heat it, if you do anything, mercury and sulfur cannot be acquired back from the kajali, that is the black colored powder that is formed when once it's processed in a particular manner for a particular duration of time. So it's a irreversible change that the mercury and sulfur have undergone into a different entity altogether, which then becomes purified version of mercury and sulfur in a combined form, which also is non-toxic in nature and can be safely used in the products. Now, when we look at this black powder formation, when you mix mercury and sulfur together and you are grinding it, you are pulverizing it together, they have given a particular sign that you have to observe again. What is the sign? There should be not a single particle in this black, single shining particle left in this black powder. So you have to triturate it in such, you have to process it till such a time continuously till the entire powder. I mean, you go out, you hold that powder in sunlight also. It will not shine, it will not sparkle. There will be not a single particle shining in that thing, which is an indicator that the mercury and sulfur have completely mixed together. There is not a single particle of mercury left in that combination, which can be then dangerous to the body if it's not prepared correctly. Is that clear? Okay, question.
What's the vessel you will use to do this?
Stone,
A stone.
because that's the only thing which the mercury will not eat into. Otherwise, any metal that you use, the mercury is going to corrode it. It is going to form an alloy with the metal. So you will not use any metal. Glass cannot be used because you are pulverizing it. The glass will break. So it is always done in a stone pulverizer. Same is the case when you are triturating the garlic with mercury. It is done in a stone pulverizer. So this branch of using mercury, sulfur, and various metals is basically a very advanced branch of Ayurvedic alchemy, where minerals, metals have been used for health purposes. And these substances, these minerals, metals, are very effective in terms of their effects on the body. Their efficacy is very high. The quantities required for administration are very less, and the effect is very fast. So this branch of alchemy, which is called as Rasa Shastra, Rasa is another synonym for mercury. Rasa Shastra, Shastra means science. So the science of using mercury, the science of using mercury and other minerals and metals for health benefits is called as Rasa Shastra, which is a advanced branch of Ayurvedic alchemy, which is very, very popular and very widely used for medicinal purposes. Obviously, it is important that when you're using mercury, when you're using sulfur, when you're using metals like iron, copper, etc., you cannot cut corners. You cannot take shortcuts. Because if you take shortcuts, if you try to cut corners, and if you don't follow the procedure to the T, there is a direct problem that you're going to create on the human health. And that is why it is extremely important that all these bhasmas, all these minerals and metals, the processing has to be perfect. There are signs given which indicate completion of processes at every stage. Those have to be meticulously followed. because otherwise you will be giving Arogyavardhini and you will be saying it's going to improve health. It will do the exact opposite of that if the product is not prepared properly. Yes.
With the quantity that you will from the basic mercury that then you will purify, what will be the quantity left that can be
The quantity that you get is not really, there isn't a lot of loss that happens. Okay, the loss is usually in the transferring, etc. But when you triturate the mercury with garlic and stuff, it is not a physical loss of substance that happens. The losses would happen only when you are transferring that again, some losses when there is spillage, etc. So in literal sense, there is no loss happening. You will get the same amount of quantity. But let's say, a 90% output will be achieved due to, human errors, losses, spillages, etc. Because
and
what happens is when you are triturating mercury with water, garlic juice, the garlic juice and mercury you have to separate out. So you are separating it out. While separating, even if you lose a small drop of mercury, still you have lost, maybe a couple of grams because mercury is very heavy in nature. So those spillages can happen whilst doing the processing, but otherwise, whilst losses due to processing as such are not there.
and in the medicine, what will be the maximum amount that we will use?
The
Both,
mercury and sulfur, you mean?
yeah.
So basically the thing is that the mercury sulfur, this is in the formulation, right? Now this formulation, when you're using it, you will use, say for example, if I'm giving Arogya Ardhini, the tablet is usually 250 milligrams tablet. If I'm using a 250 milligram tablet of Arogya Vardhini, I will probably use maybe 2 tablets 3 times a day. So, so the quantity that is going inside the body of the medicine per day is actually 250, 250 into 2, 500 milligram into 3 times. So about 1.5 gram of medicine is going into the body, out of which probably the mercury sulfur will constitute to about, 20%, 30%. So even mercury sulfur combination as such can be given, in higher dosages because it's pure, absolute. But because there are other ingredients like there are the bhasmas, there is triphala, there is shilajit, etc. So the quantity of mercury sulfur going in each formulation will vary, but that does not really cause any problems because the mercury sulfur has been purified to the to its best form as such. And every formulation will have a different percentage of mercury sulfur going into it. Okay, but to answer your question, even if tomorrow we decide, can we give this mercury sulfur combination in say 250 milligrams on its own to the patient? We can, because it is safe. Okay. So that explains basically the mercury sulfur issue. I have already asked you to research something that you're going to do tomorrow. Now, when we talk about the bhasmas, the Loha Bhasma, the Abrak Bhasma, the Tamra Bhasma, which is the copper Bhasma, we will be studying individual Bhasmas also, some important Bhasmas individually, where we study how it is processed, how it is formed, etc., and what are the uses. But just to explain in general how a Bhasma is made, how Bhasma means ash. Okay, Bhasma means ash. So you basically oxidizing the metal into a form which is like a ash. Okay. Now, when we say ash, we usually immediately relate to a black substance or a white substance being formed. Right? When we say ash, the imagination or the visualization is usually something black or something white. So first is black and then is white. But when we make the bhasmas, when we make the ash of various metals, the color of the ash will be different for different metals. Some of them will be probably black in color, some of them will be reddish in color, some of them will be brown in color, uh, some of them will be whitish in color. So depending on the metal, the colors are different. But in general, when we look at the processing of a metal into a bhasma, the metal is first purified. The metal is first purified and purified by basically triturating it or heating it up and dipping it in some different herbal decoctions. That is the usual method of purifying a metal. So basically you heat up the metal and then you immerse it into a herbal decoction which will then purify and keep on repeating this process for a certain period number of times for the purification to happen. Once the purification has happened, this heating the metal and dipping it in decoction also makes the metal brittle because of the opposite use of hot and cold. So when this metal becomes brittle, then this metal is then broken down into smaller pieces, triturated with various juices, made into like a combination of trituration with metal, and then it is burnt at very high temperatures for certain number of times as suggested for each metal till you achieve a ash which is of a particular color, which does not have any shining particles in it left. Okay, so these are the indicators of whether the bhasma has been prepared properly. So number one is basically certain number of times it has to be done. Second is if in spite of doing it certain number of times, there are certain shining particles in that bhasma, you have to continue doing the process. Still there isn't a single shining particle in the bhasma. And then it is used for medicinal purposes. Now, heating it at a high temperature is something, when I say high temperature, the temperatures go as high as 1200 to 1400 degrees Celsius. It's a very, very high temperature, which is usually achieved by heating it with cow dung cakes, or it is achieved by heating it in furnaces. Both these methods are used nowadays. A furnace heating is also done where temperature can be controlled, and cow dung cakes is also used where the temperature is reached at a certain point. Now, the difference, I mean, the purpose of using cow dung cakes is like when you have, say, a loha bhasma, like a loha or the iron has been purified, and then it is triturated with certain herbs, and then it is made into like a mixture, kept in a earthen pot, and that earthen pot is surrounded by cow dung cakes and it is burnt. It is the cow dung cakes are fired. Once they are fired, the temperature of that entire thing reaches to 1200, 1400 degrees. Once that happens, and then the cow dung cakes extinguish, when the fire extinguishes, the temperature drop down is also gradual, which is not possible in a furnace because the furnace will heat up to 1400 degree and then it will start cooling down, where the cooling down will not happen in a particular manner for a particular duration of time. Whereas cow dung cakes, the cooling down happens in a particular manner where the temperature drop is also gradual, where also this heating process or oxidation process is continuing onto the metal that is being heated with. So this cow dung cakes method is used for the bhasma preparation more than furnace. Even today, traditional method is used rather than the furnace. And then this process of trituration and heating or oxidation or firing up the metal can be done for say 13 times. Like for example, gold Bhasma. When you do Suvarna Bhasma, the gold Bhasma, it is done for 13 times. For Abrak, that is the mica Bhasma, it is done for, about 30-35 times. For copper, it can be done for about 50 to 100 times also. So you can see that, if you are doing, say, for example, a gold Bhasma, you start the process today, you do the trituration today, one day, and the next day it is heated up. The third day it cools down. The fourth day you again triturate it. So one cycle of heating will take 4 days. So even if you are doing a gold bhasma, which takes about 13 repetitions of this process, 13 into 4 is 52 days. So it's a 2 month process nearly to make a gold bhasma from the start, which is relatively easier to make in terms of the number of times this process has to be repeated. You look at copper bhasma, tamra bhasma, which is done like it can 20 times, 30 times, 40 times, sometimes 50 times, because copper is very difficult to convert into the bhasma. So it may take longer. And if you are going by this day, then basically you are processing it for 4 to 5 months, 6 months also, one bhasma. So these are long, tedious processes taking lot of time, lot of effort, and that also makes these products expensive because the number of human hours going behind this processing are very high. So the reason I explained this just now is so that you understand that when we say bhasma, when we say mercury sulfur, how are they actually used in a preparation? Okay. Now, once you have these ingredients and it is triturated with neem juice, neem swarasa, it's all mixed together. It is triturated. Once it's triturated, again, they have told how many triturations have to be done. Every formulation, they have said how many triturations have to be done, which means if suppose neem we are doing, okay, if suppose there are 3 triturations to be done, then you add neem juice into the combination, into the powders, etc. of all these ingredients, triturate it together till it becomes a thick paste. Once it becomes a thick paste, you have to dry it in the sun. When it dries completely, then you bring it back, again triturate it with neem juice, again dry it, again bring it back, then triturate it. So it is a long process of trituration, pulverizing, and then processing. So that is how the uh, formulation is made. And then it will be made into tablets or it will just be kept as powder depending on how you want to use it. A lot of times these formulations are kept as it is as powders because people don't want to make it into tablet. Because people want to have the flexibility of using the right amount of dosage depending on the patient. If you go into tablets, then you are stuck with 125 to 50 milligram tablet every time. So if you want to give, like 100 milligrams to somebody or 80 milligrams to somebody, you cannot give it. And that is why a lot of times Ayurvedic experts or doctors, they prefer having these formulations in form of powders rather than making into tablets. Is that clear? Now, Arogyavardhini, the main ingredient is Katuka, which works on the liver. Katuka helps in secretions of Pachaka Pitta. Shilajit and Tamrabhasma also help in the smooth flow of this Pitta to the small intestine, which is its site of action. Hence, Arogyavardhini is used in various liver disorders, mainly liver disorders where liver functioning is affected, like hepatitis, etc. In general, also, Arogyavardhini can be used for improving the liver functioning in various conditions. It is also used in cirrhosis of liver and conditions like ascites due to disturbances in liver and enlargement of liver. Liver cirrhosis is basically a condition where the liver cells have been damaged. Liver cells have been damaged, they have died. Okay. Why this happens? This can happen because of excessive alcohol consumption, because alcohol causes damage to liver cells. So alcohol consumption excess can cause liver cirrhosis. Sometimes certain toxic substances being consumed by the person, sorry, can also cause liver cirrhosis. So sometimes people who work in chemical factories or chemical industries, certain chemicals can be inhaled by the person continuously whilst working, which can cause liver damage and cirrhosis of liver. So in these cases also of liver cirrhosis, Arogyavardhini can be used as a product of choice. Kidney disorders leading to edema, weakness of heart, Arogyavardhini can be used in those cases. Pitta and Rakta are interrelated and hence disturbed Pitta can cause Rakta disturbance also. Liver is the site of blood formation, hence liver functioning is critical in proper Rakta formation. Arogyavardhini helps in reducing the Rakta Dushti, hence can be used in skin diseases caused by blood disorder. Now, what happens is skin diseases predominantly happen because of the disturbances with the Rakta Dhatu. When the Rakta Dhatu is disturbed, when the Rakta Dhatu is affected, that is when a person will experience or will have various types of skin diseases. Whether it is eczema, whether it is urticaria, which is itching, whether there is, there are just hives happening, whether there are skin eruptions, any kind of skin disease, whether it's, any skin disease like psoriasis or any other chronic skin disease, it will always be related to two things in the body. One is the blood and the second is the liver. And as you know that the liver is the most important organ for detoxing the body. So if the body retains toxins or if the body holds toxins, then these toxins are going to cause disturbances with the blood. The quality of the blood is going to get disturbed, and then that will result into various kinds of skin diseases. And that is the reason why Arogyavardhini, which is a very strong liver stimulant, which improves the liver functioning, is advised to be used in majority of the skin diseases because majority of them are coming through one common factor or one common etiology, which is disturbed blood and disturbed liver. Okay, so a lot of skin diseases you will use Arogyavardhini as a product for correcting or curing skin diseases. The neem trituration also improves its capability to purify blood and improve liver functioning because neem is known to be a blood purifier. Neem is known to be a liver tonic. So that further helps, the trituration further helps in improving the functioning or efficacy of the product in general. Arogyavardhini also helps in anemia by increasing the Rakta formation. Loha and Tamra, which is iron and copper, also help in the same. So, anemia is usually in Ayurveda. What is Pandu? What is Pandu?
Do you want to just
Pandu? You studied that, right? The disease?
Just said it.
Sorry?
You said it. It's literally pale, which I think it's anemia.
In literal sense, it's anemia. If compared to the Western science, but what is Pandu in Ayurveda?
Paleness.
Sorry?
Paleness. Like
Paleness.
paleness.
Yeah. Why does that happen?
Because so it's related to Rasa and Rakta Dhatu.
Yes, it's related to Rasa and Rakta Dhatu. So anemia is when we say anemia, which is the Western disease, it is purely blood related. It is basically the hemoglobin content is less, the blood formation is less, and that is why anemia is caused. So when the blood formation is less and that is happening, the Rakta formation has to be stimulated, which will be done by Arogyavardhini as a product, because there are various ingredients in it like Shilajit, Loha, that is iron, Tamra, copper. All those will increase the quantity of blood in the body. When we look at anemia in terms of Ayurveda, which is Pandu, that will be helped by improving the digestive function. Because if it's a rasa problem, the rasa is disturbed at the stage of digestive functioning. When the digestion is not proper, the rasa is disturbed. When the rasa is disturbed, then the quantity or the quality of rasa is not proper. When the quality of rasa is not proper, then the person will experience symptoms like the skin becoming pale, sound sensitivity, palpitations, etc., etc. So all those signs and symptoms which you see in Pandu, they will be rasa related and rakta related. So both these conditions will be corrected by Arogyavardhini. Hence, it can be blindly used in cases of anemia, whether it is rasa or rakta related. Then upper respiratory tract issues like tonsillitis. Arogyavardhini is excellent. Okay. In fact, it is said that Arogyavardhini is like an anti-inflammatory product which can be used for inflammation in any part of the body. So anywhere there is inflammation in the body, Arogyavardhini can be used, because Arogyavardhini will improve the functioning of Pitta by improving the liver functioning, thereby improving the quality of Pitta, improving the quantity of Pitta, and once that is improved, then obviously the inflammatory processes will be controlled. And that is why Arogyavardhini can be used as an anti-inflammatory in general for the whole body. Now, when somebody suffers from chronic fever, it causes liver and spleen enlargement. It increases the fatigue levels. It causes anemia and weight loss and dryness in the body. Arogyavardhini helps in these conditions also. So chronic fever with fatigue, weight loss, etc., Arogyavardhini helps. Repeated indigestion is mainly due to liver not functioning properly. In those cases also, Arogyavardhini can be used. Somebody who constantly complains about, not being able to digest the food properly, constantly is sick because the food is not getting digested properly, suffers from bloating, heaviness in the stomach, etc. Arogyavardhini can be given to improve the liver functioning, because it improves liver and then improves the digestion. In constipation, Katuka is a mild laxative and helps. Arogyavardhini helps, which is not really the where you will use Arogyavardhini as such. Like if it's constipation, you will use Arogyavardhini is not seen mostly. There are other formulations that can be used. So, but also one of the uses given. In high blood pressure, which is systemic blood pressure related to Raktavasrotas, which is related to liver, Arogyavardhini is used for reducing the blood pressure or controlling the blood pressure, bringing it to normal. Now, when we talk about blood pressure, there are two types of blood pressures, or there are two reasons for blood pressure to happen. One is stress-induced blood pressure, where a person suffers from increased blood pressure because of stress. So what happens is, when there is stress, the blood vessels, they undergo vasoconstriction, they contract because of the stress. When they contract, then obviously the pressure inside the blood vessels will increase, and that is called as stress-induced blood pressure, for which you will have to take substances which will calm the mind down, pacify the mind. It will improve your sleep. It will make your mind more stable. If once that happens, the stress reduces, you will have to undertake some stress relieving therapies also like Shirodhara, Nasya, meditation. Once that happens and the stress reduces, the vasoconstriction also reduces. As soon as the blood vessel becomes bigger in size, the constriction reduces, the contraction reduces, the flow normalizes, and the blood pressure regulates. That is how the stress-induced hypertension will be reversed. In cases of systemic blood pressure, which is basically coming through the liver, where the liver functioning is disturbed, if the liver functioning is disturbed, then that will cause certain toxins to be released in the blood. That will cause certain changes in the blood vessel walls, which will cause constriction of the blood vessels, and then which will cause basically blood pressure to increase. That is one reason. Second is when the liver functioning is hampered, there is excess pitta that is formed in the body, excess pitta, which will then increase the blood volume as such. Once the blood volume increases, that will also increase the blood pressure. So that is the systemic blood pressure as such. Now, Arogyavardhini is only used in systemic blood pressure conditions. It will not be used in stress-induced hypertension. Arogyavardhini will only be used in systemic hypertension, where it will improve the liver functioning, it will improve the functioning of the Raktavasrotas, it will improve the quality of the blood, it will improve the quality of the blood vessels, and thereby improve or thereby help in high blood pressure or hypertension. Is that clear? Yes, Nicole?
Just wondering, so say a client comes to you, often they may be, how do you know if it's through stress? I know asking them questions, but then often they might have stress, but also maybe have a lifestyle that's bad for their liver. So they might have a bit of both. Is that possible?
They can have both, meaning that it can be a stress-induced hypertension, which is further aggravated by liver functioning disturbance, or vice versa also. So somebody has a liver disturbance which is resulting into some kind of a hypertension, which is further aggravated by stress. So, but you will have to, when you analyze a person, when you do a client analysis, you will have to understand what, because see, there are certain signs and symptoms of blood pressure, right? The person will experience certain discomfort, like say headaches, nausea, giddiness, dizziness. All these will be experienced by the person. So you will have to check, when does the person experience that? Is stress causing those symptoms to aggravate, or they are always there and they further increase when the person is stressed? Because that will give you an idea that whether this is stress triggering the problem, or it is there, stress is further aggravating the problem. And then accordingly, you deal with it.
Okay. Yep.
Okay. If suppose you see that the person is saying that, if I am stressed at work, etc., I have headaches, or I have, dizziness, I feel giddy, I feel uneasy, I sweat a lot, then yes, stress is causing that problem. You will correct the problem by dealing with it from a point of view of stress management, etc. In spite of that, there is a possibility that the person will say that occasionally I still feel the problem. So then in those cases, the underlying uh, root cause, which might be the liver, that also will have to be dealt with. Okay.
Thank you.
No. And then, like we have said, hemorrhoids, varicose veins, they also arise. The root cause is also in the liver functioning, the liver not functioning well. Arogyavardhini is also used in these conditions of hemorrhoids and varicose veins. In general, it improves appetite, digestion, energy, strength. It is balya in kids, and hence the name Arogyavardhini. It is like a rasayana in general, by improving appetite, by improving the digestive function. The dosage of this is 500 milligram to 1000 milligram, which means 2 to 3 tablets, 2 to 4 tablets 3 times a day. So you can give it in this dosage. If it's a powder, you can simply give it in 500 to 1000 milligram 3 times a day. In kids, it is about 500 milligrams 3 times a day, which is about 2 tablets into 3 times. Anupan, which means with what do you give the medicine? You can just use water, plain water, room temperature water. No need to use warm water, etc. In these cases, you can just use plain water as a anupan for giving this medicine. Clear? Any questions? Yes.
Able to do that in here? Are we able to find this medicine or to import it?
We've got it.
Oh, it's okay in Australia? So this medicine is okay in Australia then?
Yes. So we have a we have got it through TGA approved in the center also. So there must be other places also who must have got it.
Yeah.
So basically the whole idea is, you need to have certain ingredients in certain percentages is what the TGA expects. And that is how basically they allow you to import certain products. So as long as you maintain those ratios, you maintain those percentages, they will allow you to bring those medicines. Okay. Yes.
When to take it? Depend of the condition and
Well,
before.
depending on the condition, because when you are taking it for digestive systems, you will obviously take it during the samana period, which is naturally going to be your samana period or apana period. When you are like, for example, they have said that you can also use it for upper respiratory tract infections in some cases. If you're using it at that time, you will use during the Vyana Udana period. So depending on the condition where you want the effect to happen, which system do you want it to work on? Accordingly, you will choose the timings. Correct. So Arogyavardhini, for example, if you want to use Arogyavardhini for in general for liver function, you will use it basically during the Samana period. But you're also using it for hypertension. You will also use the Vyana period for it because you want it to circulate throughout the system also. So depending on how, where, which system, which srotas you want it to work, you will use the vata subtype to take it to that site of action. Clear? Yes. So that's exactly what happens when you do case studies and cases, right? Because I can give you simulated scenarios here, but when you actually sit with a person and you take a case history of that person and you realize that this person has, say, hypertension, or this person has digestive system problems, then you decide when you give that medicine to that person based on the condition. And that is why case studies clinics are critical, because they will give you the actual application of what you're studying here in the theory, because there you will be dealing with real humans, whether they are in a clinic scenario, whether they are in a simulated scenario, you are still dealing with humans. If suppose you have a person who sits in front of you and you take a case history and you find out that this person has, say, hemorrhoids, then what? You want to give Arogyavardhini? You want to give, okay, you will give Arogyavardhini. You want to give maybe Kutaja? You will give Kutaja depending on what is the condition. Then based on that, you will choose the timing, whether it is to be given during the apana time, whether it is to be given during the vyana time, what is the purpose of that? There might be, so the actual application of that, the principles you have studied, that the 5 subtypes of Vata will govern when to give medicine. Now, when you sit down and when you start looking at cases, the cases will then bring you back to all the theory that you have studied. Like, for example, if a person comes and sits in front of you and says that, that I have some skin problems, then you will go back and try and understand which causative factors are causing those. We'll try to relate the theory to the practical. Once you have done that, then you will try and relate the signs and symptoms to the types of skin diseases that you have studied. Then you will bring in the medicine part of it as to which medicine to give depending on what is the condition. And then the last will be depending on where you want it to act, how you want it to act, you will choose the timing. And you do this, multiple times, that's when you will start getting it right. Because at this moment, it's all just like a Lego puzzle, still not fit together. That will only fit in together once you start applying it on people. Till that time, it will always be a question mark. You will always have questions. You will always have queries as to how do you apply it. Once you start applying, then you will start learning. Then you will start making mistakes, which will also help you learn. And then the Lego blocks will start fitting in. The puzzle will start becoming a clearer picture as such. And that's why the clinics, or that's why the cases become extremely critical, extremely important. Where you study the patients, you analyze them, you go through their histories, you talk to them, and then you apply it to what you have studied physically in the lectures, and then you try and see what is the remedy.
Understand the whole concept, but personally, I'm absolutely not confident in understanding when exactly. So maybe it's me. I need to study more about the subdoshas.
No, I won't say that, because this is something that we have also gone through when we were studying. Okay, this is a common situation because the information is so much and it is so overwhelming that we all go through that stage where we feel not confident enough to be able to deal with the patients in real world scenarios. Okay, and that's why I said that the real picture will start appearing as you start dealing with people one on one. And that also, I'm not saying you will be right from day one. We're bound to make mistakes because that's what is the learning curve. You make mistakes, you learn from those. As long as we don't kill anyone, that's fine.
Not make mistake with health, but
No, that's what I'm saying. As long as we don't damage somebody's health, it's fine, I'm saying. Mistakes are errors, basically. It's an error of judgment. It's a mistake of intellect at our part. The next, yeah.
When you give us the herbs or things like that, I would love to know, okay, well, obviously morning it's Rasayana, so, and each time of the day we know, okay, that would be helpful for me.
Repeat the question.
Like, good thing for me that will be helpful is that you give to give us in every time of the day that is applied for each condition. So I know morning is Rasayana, but for the rest of the day with the condition. Does it make sense?
So you're saying that morning is Rasayana, right?
That's what I understood.
That is clear.
Yes.
Okay. Laxative is if you are to use a substance as a laxative.
Before? While eating?
Which is the apana period?
Or before bed, just before bed, laxative.
Before bed. So when you're giving a laxative, it is usually before going to bed after dinner. So it's not immediately after dinner. it is before going to bed, you give a laxative, it will have a laxative effect. These two timings are clear. Correct. Now this is only for laxative effect. But if suppose somebody has a problem, which is, say, for example, a menstrual problem where the flow is not proper. There is a female who complains that the flow is not proper, it doesn't start immediately. I have a feeling that it's obstructed and I feel severe pain till the flow starts. What does that mean? That means that the apana functioning is not correct, where the apana, when the flow has to start moving downwards. It is not moving downwards. It is doing the function of holding on longer than it is supposed to do and not starting the function of evacuation. Correct. This is a apana functioning disturbance. If suppose somebody says, I have a problem with, say, repeated miscarriages. That is also an apana functioning, which is the opposite of holding. If somebody says, I have a function of malabsorption, what is that? That is also a functioning of apana, that the absorption is not happening properly. Of course, it's a samana also, but there is also an involvement of apana. Do we need laxatives in this case? We don't need laxatives. Correct. So the nighttime application of apana is out of question. What do we need? We need to regulate the functioning of apana. So when we choose a medicine to regulate the functioning of apana, when will we give that medicine during for apana? That will obviously be before lunch. That's the apana time, right? Before the meals, sorry. So understand that we have to regulate the functioning of vayus, which play an important role, based on which the disease, you have to understand what is going wrong and then choose what is to be done. As far as the respiratory problems are concerned, it's easy. Respiratory problems cannot be out of the purview of prana and udana. Which means any medicine that you are giving for respiratory problems, you give it in the prana time, which is the morning time, which is the rasayana time, and you have to give it during the udana, which is after the dinner. So when you start looking at each condition, when you start looking at each disease, you have to understand, like I explained just now, the apana, you have to start looking at it from that angle, that where is the problem? It is the problem of annavasrotas, purishavasrotas, understood. Then should I give it during the time of samana? Maybe. But is it a problem of samana or apana? It is probably a dominant issue of apana. Then I have to use apana time also. So you have to start understanding the diseases in this manner, the functioning of 5 subtypes of vata in this manner, and then try and understand the vikruti also from an angle of the 5 subtypes of vata. So like you said, maybe, I need to study more of subtypes of vata. Yes, obviously, because we, till date, we have only dealt with it like, oh, these are just 5 subtypes of vata, pitta, kapha. No, they have more than that to do in your body. They are going to be responsible for functioning also, and they are going to be responsible for the disturbances also. Now, when I say that, I am going to treat people now, I cannot be talking so superficially by saying this is a vata problem, this is a pitta problem, this is a kapha problem. No, I should be able to dive deeper and say this is a prana problem, this is a udana problem, this is a samana problem, this is a vyana problem, this is a pachak pitta problem, this is a bhrajak pitta problem. I should be able to go to that deeper level, without which I cannot then choose the herbs. I cannot choose which timing to give. Now, why do we choose turmeric for skin diseases? It is pitta increasing, but we still choose turmeric for skin diseases. Why? Because it regulates the functioning of Brajaka Pitta. It improves the functioning of Brajaka Pitta. But for that, we should know that the skin problems are always related to Brajaka Pitta. If we don't know that, then we will not be able to understand how turmeric works on skin conditions. So the 5 subtypes, I would request that everybody should go back and study the 5 subtypes in details, because that is the end of the day, that is explaining you and in detail as to where what they are doing. And if they are explaining that this is where the Shleshak Kapha works, this is where the Kledak Kapha works, then obviously the same Kledak Kapha can cause problems also in that area. So what is Kledak Kapha's function? Kledak Kapha in the stomach does the function of lubrication of the food. It also does the function of protecting the lining of the wall. That is the normal thing. If the Kledak Kapha increases, what will it do? The first thing it will do is it will start diluting the Pachak Pitta which is there. If the Pachak Pitta gets diluted, that is what happens in cases of acid reflux, that the Drava element in the Pitta, which is supposed to be less when the Agni is strong or when the Pitta has to acquire the Agni form, if the Kledak Kapha increases, that Kledak Kapha is going to increase the Drava element, the liquid element in the Agni, and make it into Pitta again. Once it becomes Pitta, the digestion is going to get hampered. So when we study that, also study it from this angle also. Okay. So, I mean, I will see if I can do a quick recap of that sometime. Okay. And yes,
With respect, I'm not sure that I do have this information exactly. So I'm gonna go back to my studies and let you know if maybe
Yes.
I will need more of the timing and things. But Hillary is showing me, so 12.5. Nothing. Okay, I'll let you know. I will check and
So the next formulation is Sanjeevani Vati. The ingredients are Vidanga. Vidanga is like a anti-helminthic. It is a it kills the worms. It kills the worms is what is the main function of Vidanga. Shunthi, you know what Shunthi is. Pippali, Triphala, Vacha is Calamus, Acorus calamus, Guduchi, and Bhallatak. Bhallatak you are going to research and we are going to talk about it tomorrow. So these are the main ingredients of Sanjeevani Vati. Okay. Now Sanjeevani Vati, if you go and understand, it is best for digestive system problems. That is what has been given in the textbooks. The Sanjeevani Vati, where it has been explained, it says that Sanjeevani Vati is one of the best products for diarrhea and dysentery. Diarrhea and dysentery. What is diarrhea? Diarrhea is loose motions. What is dysentery? Dysentery is loose motions with infection. Okay, diarrhea is loose motions. Dysentery is loose motions which are because of infections. So say for example, you have eaten bad food, you have had bad water. You know, a lot of people, they come to India, they end up having, disturbed stomachs when they drink outside water. So that is something which is waterborne disease or foodborne disease because of the infection, cross infection coming from food or coming from water. So Sanjeevani Vati or Sanjeevani Gutti has been given or has been suggested as one of the best products for such infections of the digestive system, resulting into diarrhea, dysentery, etc. So In general, whenever you see or whenever there is a problem related to digestive system and particularly diarrhea, dysentery, Sanjeevani Vati or Sanjeevani Gutti should be used without any doubts at all. Okay, I will tell you, if suppose ever I see anybody around me in my family, myself also having any digestive system problems ever, which is, I have had, say, loose motions, or I have not digested the food properly, and I have had some bad food or stale food, and because of which my stomach is upset, I will simply go and take two medicines immediately. One is Arogyavardhini, second is Sanjeevani. I will pick up 3 tablets of Arogyavardhini, 3 tablets of Sanjeevani. I will eat them. I will have them. After 3 hours, I will have another second dose. And I have never had to go beyond the second dose to treat the problem. Why? Because Arogyavardhini will take care of your liver. So if there is something wrong with your liver and your digestion is affected, it will correct that. Sanjeevani Vati will take care of the infection. If there is any infection in your digestive system because of bad food, bad something that you have eaten, that will take care of it. Apart from its other effects of Sanjeevani, which are also binding the stools, stopping the diarrhea. So it is not something that will just stop the loose motions. It will bind the stools. It will act as Deepan Pachana and then have the Grahi or the binding effect, which is what is expected in any of these conditions. You don't want that if there is ama in the body. If suppose I am having this problem and I have ama in the body, I don't want to just stop the bowel movements happening, because sometimes body is trying to throw the poisonous or toxic substances out of the body. So I don't want to stop it and then hold it in the body and then let them spread in the body and cause more problems. But what Sanjeevani does is, along with Arogyavardhini, it will digest the toxins also, it will digest the ama also, thereby not letting any adverse effects happen on the body. Now, I'll give you another example. One of the best remedies for stopping diarrhea, which is uncontrollable, is nutmeg. Nutmeg powder, if you take, it will stop diarrhea like anything. The person will get constipated. It will act so strong. But that does not necessarily have the property of digesting the ama. So you will only use that in severe situation where the person is losing water from the body, vital minerals are being lost, salts are being lost, and is heading towards dehydration. That is where you will use that kind of a medicine. But otherwise, Sanjeevani would be the choice of drug for any kind of digestive system and digestive system disturbances. Like if it's a cancer patient who has incontinence of stools, the bowel movements are not in control, the muscle has lost its tone, and that person is constantly passing the stools without having even the sensation of passing the stools. There, nutmeg will work, because nutmeg will not only bind the stools, it will not only stop the bowel movements, it will also strengthen the muscles, contract the intestinal muscles, thereby improving the holding capacity of the intestine. So here, Sanjeevani Vati is a very different product as such. Excellent product for digestive system problems, excellent for diarrhea, dysentery, infections of the digestive system particularly. And then it is also used for reduced appetite, loss of taste, loss of energy, heaviness in the body, fatigue, bloating, loose motions, vomiting. So when all these signs and symptoms are seen together, Sanjeevani Vati is again becomes the choice of formulation to be used. It is anti-helminthic. It kills worms because of two ingredients in it. One is Vidanga and second is Bhallataka. So though this is called as anti-helminthic, the anti-helminthic action or anti-worm action can be extended to antibacterial action also or antibiotic action also, and you see the results of that. And that is why it is used in infections. It is not simply the intestinal worms that it is going to kill. It will also cure the infection. It will also correct the infection. That is how Sanjivani Vati will work. Now it is diaphoretic in action. Diaphoretic means it induces sweating, and that is why it can also be used in fevers. Okay, though it's not very commonly used in fevers because there are other products which are more effective in cases of fevers. But being diaphoretic, you can also use Sanjivani in cases of fevers. In allergies resulting in respiratory diseases, Sanjivani is very effective by improving the digestive functioning and also directly working on the respiratory system through Pippali, Vacha, Shunthi, and Bhallatak. So Sanjivani has Pippali, Vacha, Shunthi, and Bhallatak. Vacha is calamus, Shunthi, you know, and Bhallatak. Through them, it will also directly work on the respiratory system and correct the functioning of respiratory system, improve the functioning of the respiratory system. Please understand that Pippali, long pepper, is the best herb for the respiratory system. In what sense? It will actually correct the Kha of the respiratory system. It is like a rasayan for the respiratory system. And that is why whenever you are using any formulation that is used for respiratory system, you will invariably find Pippali as the ingredient in that formulation. Whether it is Sanjivani, whether it is Tribhuvan Kirti, whether it is Shwaskuthar, all these formulations that we will study, you will see that Pippali is there. Because it is the choice of herb, it is the herb which will be used or which is effective as a rasayan for improving the strength of the respiratory system, correcting the Kha, removing the Kha, and hence this will be commonly used for that. It is a preventive medicine due to effectiveness in dealing with digestive system problems. So people who tend to have repeated infections of the digestive system, people who tend to have a tendency of indigestion, they can take Sanjivani as a prophylactic or preventive medicine also. Like in small doses, one tablet maybe 2 times a day along with your meals. That will further help the digestive process in that. A lot of times, when people travel to countries where the chances of having stomach disturbances is high, Sanjivani can be consumed on a daily basis. Even though you don't have any infection, it can be consumed on a daily basis. Like, for example, you are not used to, the Indian food and the Indian water, etc. And you're traveling to India or Sri Lanka or Nepal, countries like this, where, you're not used to that. Those cases, you can always basically continue taking Sanjivani Guti, or you can advise taking Sanjivani Guti. It can be one of your medicines in your travel pack which you can consume on a daily basis as a preventive medicine to avoid any upset infections of the digestive system. Mainly waterborne diseases is what it takes care of. 500 milligrams 3 times a day, preventive 250 milligrams 3 times a day. Anupan is water. So these are the dosages. Obviously, I mean, Sanjivani, like for example, I had mentioned this earlier that I had used this for urinary tract infection also recently. I have used this for urinary tract infection also. Why? Because I didn't have anything which was antibiotic. The person was not able to go to the doctor because, the doctor was not available for a couple of days. And the person was having very severe urinary tract infection. So I used Sanjivani Vati. How did I use it? Sanjivani Vati or Sanjivani Vati is not a product which has a natural affinity to the urinary system. It has a natural affinity to the digestive system because that is where its action is mainly. That's where most of the ingredients function. So all I did was I used it instead of using Anupan as water, I used another product called as Varunadi Kwatha, which is a medicinal wine which is mainly used for urinary tract infections, or rather urinary tract problems, urinary tract infections, and urinary calculi. It is used for urinary stones. So what does that mean? That product has a natural affinity to go and function on the urinary system. I use that product as a Anupan. Along with that, I gave Sanjeevani Vati, and I, dealt with a urinary tract infection using Sanjeevani Vati. The logic behind that was again the same, that if there are two ingredients in this Sanjeevani Vati which are necessarily antibiotic in action, I will use it as a product for urinary tract infection also. Obviously, because one, I didn't have any other specific formulation at my disposal to use. And secondly, the person was unable to go to the doctor for a certain period of time. So I had to use something from what I had available with me, and I used it and we got really, really good results. Okay. Do you want to stop and come back in 15 minutes, please? So we're going to study three more formulations today, and then we will, if time permits, we'll start the herbs. Otherwise, we'll do them tomorrow.
Okay, I'll show.
The end of the